Good evening, everybody, and welcome to the ACHE webinar series. Tonight's webinar is Hypnosis for High Blood Pressure and is presented by Eva Clark. Eva has a full-time practice working with chronic disease. She's done extensive work with multiple sclerosis. Additionally, Eva directs the nonprofit Mind-Based Healing, where she teaches hypnotherapists, NLP practitioners, and psychotherapists how to use mind-based practices to effectively work through the psychosocial factors. So everybody, I'd like to introduce to you all Eva Clark. Thank you, Eva.
Hello. So as people are starting to get into this webinar, we're going to be looking at today hypnotherapy for high blood pressure. In medical hypnosis, there are three areas very common. It's kind of like our bread and butter. Working with pain, which probably quite a few of you have training in that. Working with IBS, a lot of tummy issues, and working with high blood pressure. The good thing about working with any of these three is that there's actually already a lot of research. So if a client comes in and is asking, well, is this going to work with, my high blood pressure? There's a lot of research that you can send to them, especially the very, logical minded ones. And in that research, there's a lot of success, both short-term, mid-term, even long-term. Now, the thing about research, and this is something that you can explain to your clients, is when you do research with hypnosis, you need to use a genetic script, right? It's like you need to use the same amount of sessions, the same thing done in every single session. And even in that case, research has shown it to be effective, even when it's just a young practitioner reading a script. So in your private practice, you can be a lot more effective than research because you can individualize it and tailor it to what's going on in their lives. And that's very important when it comes to high blood pressure. And I'll, talk to you about what areas and what things you need to be looking for. As if you guys have seen the little video of, presentation from today, the little snippet, a very large percentage of the population have high blood pressure. I had learned that it was over 30%, but I just checked yesterday, the CDC, and it said it was over 40% of the adult population in the US have high blood pressure. Half of those don't even know they have it. And 50% of the ones who do have it are struggling to keep it under control because it's difficult. The medicine has side effects. They have dizziness. They don't like it. They try another one. It's too strict. They have to take it a certain hour. And so they are looking for, what else can I do? I remember someone asked me, why do you work with these things? Why would you work with high blood pressure? And what I always say is because these are motivated clients. High blood pressure is said to be a silent killer because a lot of people don't even know they have it. Some people do, especially if you've had it for a while, they can tell when their blood pressure's gone up, but many times, and many people can't. And high blood pressure can lead to heart failure and stroke, right? So it's a serious thing. And if you tell them to do these things, unless there's something underneath it that you need to deal with, they're going to listen to your recordings. Another thing about high blood pressure is most probably the people that come to your office are going to have what's called primary or essential high blood pressure. What does that mean? 90% of the population have primary or essential. That means it is not caused by a medical condition. Secondary high blood pressure means that there's something else that's happening in the body that is causing high blood pressure. It might be issues in the adrenal glands, the kidneys, it might be medications they're taking, it might be a narrowed aorta, it might be sleep apnea. If they've already gone to the doctor and the doctor has checked that that's not what is causing the high blood pressure, it means that the theory is that there's an overstimulation of the sympathetic nervous system. Right? How well does hypnosis work with an overstimulated sympathetic nervous system, right? What is the first thing that hypnosis does in a good and long induction? So just even leading a client through a nice, easy relaxation is going to start the process of lowering that high blood pressure. So getting back to what I was talking about, essential and primary. If your client says the big word, oh, it's an essential high blood pressure, that means there's nothing physically wrong with them. It is not genetic. There's nothing broken in the body. And that means they can do a lot with hypnosis. Just a little bit about, what is high blood pressure? Normal blood pressure is anything below 120/80. When it starts to be 130, 135/90 consistently, then they're going to be diagnosed with high blood pressure as long as it's not caused by medicine or some other medical condition. I'm not going to get very technical because we don't need to. The only thing you need to realize about high blood pressure is 3 things. I'm going to get over here so you can see my drawing. High blood pressure is caused by the arteries narrowing. So think about tension, the arteries narrowing and constricting, caused by an increase of flow, going a lot faster. The body decides or thinks that a lot more oxygen needs to be pumped quickly to the limbs, and an increase in volume. These are the 3 things that will cause your pressure to go up. So anytime, as we'll start talking about, when we think about suggestions and metaphors, this is what we're going to be working with. All right, we're going to look at expanding, at slowing down, at decreasing things, not all at once. Most times the doctors have already told them that they have to cut their salt, for example, right? They have to stop smoking. They need to lose weight. They need to see, check sleep. Sleep and sleep apnea will cause high blood pressure. And they need to exercise. These elements, salt, nutrition, smoking, overweight, it does not cause high blood pressure. But if you have high blood pressure, it's going to aggravate it. So, think about salt, right? When you have salt, what it actually does is retain water in the body. If you retain water in the body, that means there's more liquid in your blood, more pressure in the veins. And so a lot of the medications will make you pee consistently because they're trying to reduce the volume, right? And the doctor will tell you don't have salt because, again, they're trying to get you not to retain too much water so that the volume doesn't increase. But these are only aggravators. We're going to get to them also in a moment. What I love about working with high blood pressure is all of your existing clients, think about it. 1 in 3, if not even more, have high blood pressure. They didn't even mention it to you because people don't know that hypnosis can be very effective with it. So it's a great place to start working with this. When you use hypnotherapy to work with high blood pressure, you're going to do several things. We're going to do direct suggestions and metaphors. And most of the time, research uses those. Things like, I wanted this part to be a little interactive. So what kind of metaphors could you use knowing that this is what's happening in the body, right? This, and that the sympathetic nervous system is overstimulated. Get over here to show you the thing. What kind of suggestions and metaphors could you use in your sessions? In my sessions, I don't just stick to metaphors. I use most of my session to really look at some of those deeper factors to see what is triggering the oversympathetic nervous system. But at the end of my sessions, I always create a recording, usually wrapping up whatever we worked on, and we'll look at some of those issues, and then adding direct suggestions. I do this if I work with IBS, with pain, with high blood pressure, always working on what I call the psychosocial factors, and then always bringing some metaphors and things to stimulate the body. As one of my teachers once said, you can, totally evolve your client and they might still have belly issues unless you link the work that you're doing with the symptom. Sometimes the body just gets used to things, right? So some of the suggestions that you can use with high blood pressure is things such as, I had a client today, I had her envision, as we were doing the relaxation, with each area she was relaxing, I had her envision that the area kind of expanded, made more space for it. And then the temples relaxed and that area had space to expand. And her neck was able to relax and had so much room to relax and expand. And, so those things, thinking about that expanding of the arteries. Also, for example, you can think of a river, right? You can think of, because most times, I'll give you an example. Mine was a temporary high blood pressure. And a couple of years ago, right before COVID, I cut my finger and I cut it really good. And I was laughing. I thought I was, I didn't think I was stressed. I was in the, we were in the ER. No one else is like, midnight, laughing about it. I got 14 stitches. And I tend to have low blood pressure. And when they took my pressure, it was actually interesting, quite high. And I thought, oh, darn, because the body was very much stimulated, right? Many times their high blood pressure might have started with a lot going on, or at the end of the day, their blood pressure has gone up because they've had so much going on in the day and nothing's going right. And they want it to go great and they were pushing it and they hope it would be perfect and it's not, and they're tense about it. So the metaphor might be, imagine a river that this storm has gone through and it's just full of debris and things, and it's just tumultuous and it's just rumbling down, the stream, and then the sun comes out, right? And this black, deep, tumultuous water, starts reflecting the sun and it starts clearing and the debris starts going down. And all of a sudden this water, you can hear it slowly, the rumbling getting lower and lower and lower again. Remember the flow, and it's slowing down and it becomes a meandering little creek, see through with the sun going down, and they're just sitting next to it again. It's that decreasing, and it's also telling them this too shall pass, right? Those are some of the examples of direct suggestions. Slowing things down, right? From speed to, going on a bicycle instead of like doing everything so fast, letting off steam. In my sessions also, I'm going to look at triggers and I'm going to help them increase relaxation. Most often I find my clients don't know how to relax, and if someone has told them, well, meditate, they're like, I'm going to try not to think, right? They don't know how to just relax. I even tell them before meditation, just sit, look out the window, look for birds, count birds, do something that isn't achievement, that isn't trying. And so oftentimes with clients with high blood pressure, it's teaching them relaxation techniques, breathing techniques, right? The typical breathing techniques. Now I'll have a client who comes in and goes, I've learned how to breathe. And I said, oh, well, show me, teach me what you've learned, right? And they'll be like, okay, I'm going to breathe in, 4 beats, then breathe out and then stop 4 beats. And what's happening is they're breathing in the top half of their chest. And that's actually when you're stressed, you breathe in the top half of your chest. So they're breathing stress-wise. So I have them, for example, I would love to invite you guys, close your eyes just for a moment. Take a nice deep breath through the top half of your chest. Breathe out. Do that a couple of times. And notice the energy in your body. Is it relaxed? Is it focused on your upper chest and head? At least myself, it kind of went into my forehead. Now, actually, imagine breathing in through the soles of your feet, gradually and slowly up, and then just releasing through all your pores. Pausing in that quietness, and then again, breathing through the soles of your feet. And as you do that, notice, where is the breath? Is it in the chest, the middle of the chest, in the gut? So teaching them little techniques that they can use during their day to kind of ground them and slow that inner chatter and that inner pressure. Then you're also going to work with triggers. What's interesting about high blood pressure is if you talk to your clients and ask them, when did they discover they had it? Like, think of my case, right? I went to the hospital, I get high blood pressure. Imagine if during that whole time, there's a lot going on in my, at work, etc. And after that, that startled, like, oh my God, I'll be damn, I have high blood pressure, right? Imagine if 1 month later, I get it checked again and I still have high blood pressure, right? And if I start reading about it, I hear that it's a silent killer, right? I hear that I could have a stroke or a heart failure at any moment, and I won't even know why. What happens with that first diagnosis is the doctor starts getting really serious. Oh, you have high blood pressure, right? All of a sudden, they start fearing taking their blood pressure, and they get what's called white coat syndrome and white coat high blood pressure, which is when they're in their doctor's office, their blood pressure is actually higher because they're like, oh God, here we go. Is it going to happen again? Is it going to happen again? What can you do for that? Anyone have any suggestions?
Conscious breath.
So having them maybe practice the breathing techniques in the doctor's office. Conscious breath.
Yes.
Yeah. Yes, Catherine.
My sister used to do deep breathing as she drove to the doctor's office the whole way there so that she'd get a good reading when she got there.
Yeah, exactly. I've done that. Yeah, after my finger afterwards, I'm like, okay. But then it becomes a thing, right? It's like you have this test that you have to take and you have to do a good job of it. And if you're any kind of perfectionist, there it goes. I will do things like in NLP, we call it, mind maps. I mean, I will ask them if there's anything that they don't have any issues with, but maybe other people do. For example, getting their blood drawn. And they're like, oh yeah, I have no issues, right? And I will actually have them imagine getting their blood drawn and then get that feeling and anchor into, getting their blood pressure. And they can actually imagine as they're getting their blood pressure, that it's getting their blood drawn, for example, help them relate one thing to another. Also, the thing about white coat high blood pressure is it triggers something which is one of those psychosocial factors, one of the underlying causes which are creating the overstimulation of the sympathetic nervous system, and it is the fear of death. Many people have it, Many people avoid it by just not talking about it. But once you've, been diagnosed with high blood pressure, it's like it comes into the forefront. For me, it's, I always say, hey, this is an invitation for us to visit and look at the fear of death. So think about it. You're taking your thing, and every time you're like, oh my God, this is just telling me how close death is, right? So what kind of things can you do to work with the trigger of the fear of death?
Going through it.
Yes, go through it with them. That is fascinating. It's like it becomes familiar. Like, oh, been there, done that. Yeah, go through it with them. I do sessions that I talk to death, when we have a conversation with death. Past life regression, give them 5, 6, 7 past life regressions. And by then they're like, got it. Different things for them to be able to face death, right? And then find out, is there someone who died when they were very young and incapable of understanding what that was, right? And maybe address that. Triggers can also be work-related, right? Perhaps they need boundaries. Perhaps they have a boss that yells a lot and it just feels like it's, it's stabbing them. And so it's teaching them to bring in a strong bubble around them as they work. Lots of noise. All those things can overstimulate the nervous system. Feeling like you have to walk on eggshells with certain people, right? Again, address those. Then managing those aggravators that we talked about. Fortunately, you probably already have some training in helping them decrease their weight and helping them decrease the cravings of salt and getting them motivated to exercise, right? And relating maybe exercise to movement when they were kids, to dancing. Reducing or eliminating the need to smoke. You want to check those out. You want to find out what else are they doing and what else do they know they need to be doing. And then teach them that hypnosis can help them with that. They don't need to use willpower. I always say use the subconscious. It's so much easier. And now, the biggest area that we can really influence that in research you can't really address is looking at the psychosocial factors particular to that person. Anytime you work with a chronic disease, there are 3 areas that influence a chronic disease: physical, the aggravators, psychological, and social. And if you do any research, especially with functional medicine, you'll see that everyone's moving in that direction. That chronic disease doesn't just happen, though it feels like it. That first time they put the cuff on, it's like, it took time to get to that point. And the things that caused and influenced that are within your life. Most people, when they think of lifestyle, they look at these, these aggravators, but lifestyle also has to do with your relationships with yourself, your conflicts. And these are the things that are probably stimulating the sympathetic nervous system. So what are some of the things that cause high blood pressure? Anger. As obvious as that might seem, I had a client, he was working with a functional medical doctor. She recommended he come work with me. We had a session, we did just a few suggestions and I got some information. And then we, started talking about relationships, and he had an ex that he said anytime he remembered her, he would curse, unresolved issues of the past. And think about the body. I always say the body's like a 4-year-old kid. The body doesn't understand the words you're saying. It understands the energy you're putting into something. And it doesn't matter if something's happening in that moment or you're thinking about that thing. If he thinks about his ex-girlfriend 4 or 5 or 6 times in a day, he sits in his car, he remembers she would, be right next to her, he would curse at her at that moment. That's bringing the body into fight or flight, right? The body's like, oh my gosh, there's something going on that he has to fight. And so addressing that, addressing if there's any anger issues, addressing, for example, if your client says, oh yeah, my mom was, oh yeah, she was an alcoholic, but it's fine. I forgive her. Right. Make sure, actually I do a session in which I let them really emote. I mean, we get it all out. We should them. We say, this is what you should have done, and then we step away. Get it all out so that it doesn't have to keep floating up in those little moments and keep triggering. Another psychosocial factor to high blood pressure is impatience. Before you guys all came on, we were having a little conversation about how impatient people tend to be lately with people that work in restaurants and bank tellers and traffic, right? Impatience and time, that time pressures. Again, think of the body. The body doesn't know when you're in a car and you're like, my God, it doesn't know that you're not in a war about to be, bit by a saber-toothed tiger or whatever else. All it knows is there's a threat out there. It doesn't know you're just trying to get to work on time, right? And so working with impatience. One thing for example, I do is we go and talk to time. I have them become time. It's like parts work, gestalt, right? And see, there was actually one exercise I'll do is when you're in a hurry. I used to do this always. Have you ever noticed that when you're in the dentist, it takes forever until you're either called or it's done? But when you are getting to work, it seems to, go quickly. Well, when I feel like I'm late for something in the car, I will imagine I'm at the dentist waiting for them to call me. And I noticed that actually it takes me less time to get somewhere, because quantum physics says that time isn't, linear. So it's teaching them things. It's listening to their, what they say. If you have a client that's like, well, I don't have time for that. I don't have time for that. I had a client who at the end of a session, I went to go get my little square to charge them. And they're like, is there something we could do that's quicker? And I was like, let me write a note about this. This is what's might be causing it, right? Watch those beliefs about time and not having time, and there's no time. What kind of sessions or what kind of techniques can you use for impatience? I would love to hear. I don't have many for this one. I have for all the other ones, I've got a lot of stuff, but impatience. Yeah.
I was gonna say, I have something. I used to have a long commute up to a couple hours each way, depending on how the traffic was. And I used to always feel so stressed out if I knew something was making me late, which was almost every day. You get to where you have to leave a whole half hour earlier than that even. But what I started realizing was that stressing about it in the car along the way does absolutely nothing. So I would actually make a point of enjoying the time, because I knew I was going to probably catch heck or feel bad when I got there, but I might as well enjoy the time before then, right? So I'd put the radio on, I'd listen to the music or a podcast or something, and just try to really focus on relaxing with that idea that I'm not going to get there any faster by stressing about it or wishing I was. So just relax and enjoy it. And when I get there, find my parking space, I can walk quickly you know,
Yeah.
and speed everything up that I can. And, but to just chill during that time that I can't, that it's beyond my control. And I think that kind of applies to anything really. It's identifying what is beyond your control, and learning to just relax with that. And then when you do get to where you can do something, you can jump on it. You could even brainstorm something before then, but yeah, there's no point feeling stressed about something it's beyond you. It helped a lot.
Yeah. Yeah, exactly. So finding out where are those time pressures? Yeah, I think there's someone else who has their hand.
Yeah. Anastasia?
Yes, thank you. I think what I would do with a client who was impatient is I would have them tap into the feeling in their body, turn it up to 5, hold it at 5, bring it down to the very first time they experience that impatience, and hoping and thinking that maybe it was a parent that they might have witnessed and then pattern that behavior after. I don't know, but that's what I would do. Take them back to the very first time they experienced it.
Yeah.
Thank you.
Exactly. Yeah, it can be a parent. Sometimes I've seen it's a teacher, it's that stress of taking a test, and then saying, hey, you know what, life is not a test. There's always also teaching them. I used to work in construction, and I worked a lot with engineers. And when they calculated something, they calculated a beam, we calculated material arriving on the construction site. We always added what was called a toleration, a 20% toleration. Toleration weight, toleration of if it said it was going to get there 5 days, we say it's going to get there 6 days. And we always add this 20% to everything. And so I will invite them to add 20% to things. It's like myself, after a session, I give myself this extra time before my next session, this toleration, in case I have to go to the bathroom, I have to return a phone call, it goes a little longer, etc. And so if they weave those toleration spaces in their lives, instead of hoping they'll get everything done in 2 hours, then that's a way to have bonus, right? Because a lot of times it's like, oh, I have 20 minutes, I'm going to go and take a walk before my next session, instead of trying to jam it all in. But yeah, definitely look at those triggers. Look at the beliefs around it. Another thing interesting enough is over responsibility. Feeling like you're responsible for you, your husband, your family, your job, you don't leave it at work, that kind of, burden, and needing to, again, what's under your control, what's not under your control.
Eva, we do have a comment
Yes.
from Evelyn. She says, I'm typing because I lost my voice. How about strategy? How do they do impatience?
Evelyn, can you elaborate a little bit?
And we may have to wait for her to type it out because she.
Another thing also, people have expectations that we can do a lot in a little amount of time. Occasionally we do, right? But expecting that to happen every day or getting mad when it doesn't isn't really realistic. And so I teach a lot of times also to my clients, and I feed it into the recordings, that our bodies, and we're dealing with the body, I know that our minds think that we are superhuman and we should do everything perfect, but our bodies are organic, and our bodies have these ultrarian rhythms, not only at night, but throughout the day. We have a peak in the morning, it kind of goes down around lunch and right after lunch, and then we have another peak. And then some people have a little bit, you have another peak, just not as high. And so what we look at is doing your work in those peaks, but instead of pushing yourself through those moments that we go down, those moments that the body kind of steps back to renew, replace, and, restore before it starts up again, instead of pushing through it, actually giving yourself that time. Because if you give yourself that time, if you go get a tea, if you put your feet up for a few minutes, if you just kind of relax, you'll actually have more energy in that next rhythm. You asked, what can we do to help clients with patients? Discovering the strategy and how they do in patients. Yes, yes, yes. Figure out how do they do it. That's a great one. How do they do it? And then see how to interrupt that. Yeah. Yeah. And finding out what is the positive purpose. There's a lot. Yeah. And then create a strategy to do patients. Yes. Yeah. Great. Time pressure related, being outcome oriented. Yes. I'm going to be late instead of process orientated. I love my car. I love my music. Yes. Yes. If you think about heart disease, I don't know if anybody have ever heard of the A-type personality. It's very much related to heart disease, very much related to this. Yeah, it's about their outcome. It's all about outcome and goal. I've got to get this done. I got to do this. I have to do this. I always catch my clients aren't allowed to use the word should, right? Should is up here, right? They want to, they either expect them to, but the should is not. And it's those outcomes. It's got to be this. It's got to be this. So also teaching them 5-year goals instead of 1-year goal, right? Where do you want to go towards rather than what do you need to do today, right? We're not Amazon Prime. That over responsibility, getting things off their shoulders. Again, at least for me, one of the things I teach a lot is creating a boundary, a bubble, creating a bubble for each member of their family, but making sure that their bubble isn't wrapped around everybody in their family, thinking they're in charge of absolutely everything, right? Get to the point that everyone needs to be responsible for their part. And if they don't do it, they don't do it. And having a bubble that you can blind so that you don't see when they don't do whatever they're not doing. Any ideas for people that are over responsible?
So from David says, ask them about someone they think is patient, practice, sense of how that person is.
Yeah, finding a model. Yeah, because they probably have models in their life and their parents that didn't have patience. So you need to find a model. That's a really strong one. And you can do that in and out of hypnosis, right? Have them actually become it, feel it, gain the resources, and then take it back with them when they become themselves again. Yeah. Many times.
Catherine had her hand up.
Anyone else?
Yeah, Catherine had her hand up.
Oh, yes.
Yeah, you were talking about being overly responsible. One of the things I learned years ago was everyone has the right and the obligation to solve their own problems. And when I heard that, and I must have heard it many times before I really took it in, but then when I got it, the truth of it, I went, oh, what a relief. So I teach, that's one of the things I teach my clients.
Yeah.
And when we do for them, then we rob them of how they're going to evolve by doing it for themselves. So we do a disservice while we're making our lives nuts.
Exactly. You do a disservice and you create victims.
Yes.
Because if you save them, they're a victim. It's like, do you love them enough, or not? Because you're creating victims. I don't want to be that. I don't want them to be a victim. Then don't save them. And so a lot of times the triangle, right? The drama triangle.
Yeah.
A great one to look at and to step back and going, instead of saving, how about you coach them, listen to them, ask them, so what are you going to do? Right. Perfection. It goes with a lot of this, with the time pressures and things, right? Wanting to do it all perfect and your boss is only giving you an hour. In this, for example, again, this is a goal. Someone talked about, outcome orientated. It's like one exercise might be to, get them to make one mistake a day intentionally. See what happens, right? That can be quite scary for people. There's like the story of the American Indians who, when they sew their beautiful rugs, they will intentionally put a mistake in the rug in order to not have God get mad at them, because only God is allowed to be perfect, right? And so playing with that. What other ways can you work with perfection?
Well, not to talk too much, but I like to do parts therapy. So I would invite the part that feels the need to be perfect to step up and explore that.
Yeah. Yeah.
Anastasia?
Catherine took the words out of my mouth. That's what I would do.
Yeah. Yeah. Parts work is great for a lot of these. Apart from that fear that we talked about, fear of death, fear of being sick, think about them. If you're a perfectionist and you're always like doing things and there's goal orientated, all of a sudden you get this thing out of the blue. Oh, you have high blood pressure. And all of a sudden their whole mindset of who they are has just been rocked, right? And they're like, no, I can't, there's this fear of illness, fear of weakness. And so again, as the same things that we talked about, 1 to 5, 5 to 1, go back to wherever that fear came from. Is there someone in their lives when they were little that was sick and it was a weak thing and it was scary, and work through that. Conflicts, just like my client with his ex, he hadn't really resolved what had happened and it kept coming up, is always watch for conflicts. As Catherine and Anastasia, hearts work too, right? When dealing with conflicts, even inner conflicts, right? I want to do this, but I want to do this, right? You can do it within or this kind of thing. Anyone have any other suggestions for conflicts? Think how the conflicts are overstimulating the sympathetic nervous system, who's like, right? Pulled in 2 directions. And we've said this a little bit already, that the need for control, the need to try to control everything, trying to get it all, trying to control the traffic, trying to control everything. All of that is creating all this inner, this extra accumulated stress in the body.
So we do have a comment that says the bubble is great for conflicts too.
It is, yes. Especially if it's, the other person, whatever. Yeah, because whatever is happening, you don't want to take it personally. You want to teach them not to take things personally and to be able to see it and have a little distance from it. Because no, not everyone's going to agree with you, right? Not everyone's going to like you. Not everyone's going to have a great day or know how to speak appropriately when they're angry. And so having tools for that. And then guilt. Guilt is an interesting one. If you have something that's happened and you feel really guilty, it'll keep you up at night, right? Or wake you up at night. Thinking, oh, I should have done this. I could have done, oh my God, when I do this, again, think about the body. The body's just receiving those worries and that imagination of what could happen. And you are overstimulating that sympathetic nervous system. What ways can you work with guilt?
We could explore the limiting beliefs.
Yeah. What's behind it? What are the beliefs behind it?
Okay, Alicia says I love EFT with guilt. And then we have Anastasia, you can unmute.
Yes, I would I would again increase the feeling of guilt and take them back to the very first time they experienced guilt, and then take their present self, their adult self, and have a conversation gestalt with their adult self and the child self that experienced the guilt.
Nice. Yeah. Catherine, did you have something?
I was just thinking that I like to have clients do some journaling, because when they write it down and set it aside and come back later, it's so cathartic to just write out your feelings. So I do encourage clients to do that.
Yeah, exactly. Because anytime we're just thinking and thinking and thinking and thinking, we're bouncing things in the body, and they're not meant to be there, right? And so just writing it down, even in the dark, it doesn't matter, just getting it out. I would say, yeah, it's like what it's almost like going to the grocery store. If you write down what you need to buy, then you're like, okay, I'm gonna go, okay, let me just grab this stuff. But if you're trying to memorize it and go, okay, apples, and then what else? So it was the milk, it was it's a lot more pressure, it's a lot more, stimulation if you don't write it down. And it happens the same way. If you write down, I am angry at this for this having happened, it's like putting down that laundry list, it gets it out of the system and it doesn't keep bouncing, going, hey, you got to do something about it. Hey, you got to do something about it. You did something. Maybe you'll do something more, but you've already done something, and the body will feel that there's a reaction and a response, even if it's just writing. Another thing about guilt is guilt tends to be, the definition of guilt is doing something that might have harmed another person. And so or thinking that you might harm another person, right? I read a lot of stuff of Gabor Mate, and he talks about between guilt and resentment, always pick guilt. And so, because if you end up doing something you don't want to do because you don't want to feel guilty, and then you resent being there that whole time, right? That's really not good for you. But guilt is really about feeling and really caring about another person and caring about their feelings. And it's okay to care about them, but it's better to avoid, resentment. And so it's learning to say no as well. And being okay with, yeah, it might, you might be like, oh, I don't want to say no, but I'm going to have to say no. And then another really interesting one is check and see what are their beliefs and their identification with other family members. Lots of times, there's like the Irish have high blood pressure, or all the men in my family have high blood pressure, right? Or, well, my mom had it, so of course, at some time, I'm going to end up having it, because that's going to also affect them. How would you transform that one if they identify or think, well, of course I have high blood pressure, it runs in my family, it runs here, my mom has it, so of course I'm going to have it. What would you do there? I do things such as looking to see what things, for example, you do have in common with your mother that you love, and maybe even developing some of the other things you love about her to bring those more into your body. And then just giving her back the things that she doesn't want you to have anyway, right? It's maybe cutting the cords of certain elements. Because you can ask also, it's like, what else do you not like about your mom? I don't know. I don't like how she dresses. Okay, well, would you dress like her? No. All right, then you don't need to have her high blood pressure either. Let's take back and give her back her dressing and her health issues, and bring in her cooking and, whatever else, right? And so it's really distinguishing and giving back what isn't yours and what, that family member didn't want. Also educating them that high blood pressure isn't genetic. They don't need to have it. But if they and all their family are very overstimulated, drink a lot of beer and overweight and smoke, well, then, yeah, this is what they have in common. And this with an overstimulation is going to aggravate and cause more high blood pressure. So, yeah, yes.
I'm sorry, I was just going to say, Evelyn said addressing the limiting belief.
Yes. Yeah. So just reviewing, anytime in the sessions, at the end of the session, once I'm, I do, in the session, I'm looking for this, right? We're looking to address these elements, these psychosocial factors that are going to create overstimulation of the sympathetic nervous system. You want their body out of that fight or flight, that tension. And so you're working with these. And in the session, we'll do parts work, we'll go back to the past, we'll do whatever we need to do. And then I always add at the end of the recordings, always suggestions, right? To expand, to slow things down, to create space, right? Those 20% tolerations, et cetera, et cetera. I always add those. I'm always checking at the beginning of sessions, what kind of things trigger them? How is their relationship with their boss? What's going on? What's over pressuring? Making sure they have tools, right? For example, in the first session, a lot of times, if you take them into an amazingly wonderful, slow, body relaxation, and when they're in this spot that you see, they're like, and then you anchor it, right? You anchor it with something. Then at work, whenever they notice it in the car, they can just touch that part of their body and bring that relaxation back into the thing. We look at these aggravators, you're not going to put more logs in the fire, right? You want to make sure that they are looking at these things and not aggravating it and making it worse, and really focusing on those psychosocials.
That was Craig.
Yeah,
Worth, Greg.
I would say, Ava, thank you for that. You've answered a lot of the questions, that's why I want to wait to the end, but I have a son that a few years ago really had chronic high blood pressure. I think for a lot of reasons that you've identified, but we actually identified 3 things. And it was about his confidence, control, and his calmness. And he was able to understand those 3 things, and it went away and has never come back.
Great. Yeah, if you know what it is and you can get in there, and then make sure that any suggestions you're looking at, you're just adding a lot of these elements just to really nip it in the bud. Great. Yes.
Wonderful presentation. Thank you so much, Eva. Mhm. Thank you so much.
Yeah. I'm part of a nonprofit called Mind-Based Healing. All we do is, study how hypnosis and NLP works with different chronic diseases. So you'll see work on high blood pressure, you'll see work on IBS, and the main thing there is learning to use hypnotherapy for chronic disease in general, which in the same way we look at ways to discover the psychosocial factors behind any disease your client comes in with. We learn what they are. We get just enough information to learn what's going on in the body, to introduce metaphors, and work on triggers.
Thank you.
So, yeah. You guys are interested, mindbasedhealing.org.